This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Obparp 100 tablet is used to manage various cancers effectively. It is crucial to follow your doctor's advice while using it. Indications and uses. This medication is indicated for the management of ovarian cancer, breast cancer, pancreatic cancer, and prostate cancer, especially in cases where specific genetic mutations such as BRCA or HER-2 negative are present. It can be administered as a standalone treatment or in combination with other anti-cancer agents to maximize efficacy. How it works. It works by inhibiting the PARP enzyme, which is vital for repairing damaged DNA in cancer cells, thereby preventing their growth and proliferation. Directions for use. Take this medication exactly as prescribed by your healthcare provider. It should be swallowed whole with a glass of water and can be taken with or without food. Do not crush or chew the tablet. Your doctor will determine the appropriate dosage and duration of treatment based on your specific condition and overall health. It is essential to adhere to the prescribed regimen and not discontinue use without consulting your healthcare provider. Possible side effects. Possible side effects include nausea, vomiting, fatigue, loss of appetite, diarrhea, and headache. Some individuals may experience more severe reactions, so it is important to report any troubling symptoms to a healthcare professional. Precautions and warnings. This medication should be used cautiously in individuals with liver or kidney issues. Pregnant or breastfeeding women must avoid it due to potential harm to the child. Effective contraceptive methods are recommended for women of childbearing age during and after treatment. FAQs. 1. What is this medication used for? It is used for managing various cancers. 2. Can it cure cancer? It helps manage cancer effectively, but complete cure depends on individual response. 3. Is it approved in India? Yes, it has been approved since 2018. 4. Can children use it? There is limited information regarding its use in children. 5. What should be avoided while taking this medication? Grapefruit juice should be avoided. Thank you for watching. If you have any questions or suggestions, please leave a comment below.